So, Lori, the thing we want to talk about next is the feeling in your left arm. And what we found when you and I tested this is that you don't have the same amount of sensation in your left hand as your right hand. You could feel, obviously normally in your right hand, but light touch, you're not feeling very well. The other problem that you're having is like if you touch hot water with your left hand, it feels tepid. Same with cold water, it all feels tepid, whereas obviously your right hand can feel hot and cold normally. The other problem that you're having with sensation is sometimes you can't tell where your arm is. Like it may be down here, and I ask you to pick it up and you can't find it right away because it doesn't have very good sensation as to where it is. So a couple of strategies for that is to have good eye contact with your left hand. Know where it is at all times. So it's not caught under you, it's not in your brakes, it's not in an awkward position in bed. So that's going to be important, to have good eye contact. And like a lot of people with left-sided weakness, you have problems looking to this side. You tend to look to that side. So with your family, when they are visiting with you, they should sit on your left side so you're looking this way. So good eye contact with your hand. The other important thing is with your right hand to stimulate it. Touch it with various textures. So what I want you to try, rub your hand with that terry cloth. Okay, and a little bit more firm. So you can feel kind of the grittiness of the terry cloth. Very good. Now I want you to do the same thing with a pillowcase. Now does that feel any different from, so that's good. So what I want you to do is stimulate the hand and feel the difference. How does wood feel different from plastic? Something like when you put on lotion, can you feel the moistness of it? So anyway, lots of stimulation. The other thing that's good for your arm is, and we've done this in other chapters, is hold weight on it. So what I want you to do right now is push my hand down towards the floor gently. Good. Can you feel that weight difference? Good. So right now your joints are saying, okay, I'm pushing this much, now I'm pushing light. Sometimes I'll have people even put their hand on a bathroom scale sitting on a table and say, well, push 1 pound, push 5 pounds, just so they can get a feel for holding weight on the arm. Because this arm has problems with feeling, you're going to have to be especially careful in the kitchen or in a shop or in your sewing room around anything that's sharp, abrasive, or anything that's hot or very cold. So you're going to have to be quite cautious with that. If you're testing shower water, you want to test the water with this hand. It is very good for you to stand, let's say, at the sink to wash your hands. Again, a good chance to do stimulation on this arm. But again, test the temperature. And your water heater of your house should be at 120 degrees or below. You don't want extra hot water at home because this arm could get scalded and you wouldn't even know it. Now, it does feel pain. If something was really sharp hitting it, you would feel it eventually, but by that time the damage would be done. So you want to be very careful that this does not get injured. So do you have any questions about that?